well-being. We have it in our information. How much does this cost you in terms of well-being when what you are doing within the persons you have in the home? So we have that aspect as well, because probably those who have more PWDs within their homes, of course PWDs also have categories. They are not uniform. The blind, those without hearing, those who are lame. So these are unique. You cannot lump them together. So again, that is recognized in terms of well-being of the persons who are taking care of persons with some of these issues within the data set. On the issue of selection, and that's what Simon said. How did we select the districts? We had touched it, but first, we had a clear selection criteria about the social institution and the gender index. Then the poverty criteria, because sometimes it's perpetuated by the level of poverty within the homes. Then also the level of violence within these regions. Then after getting all these districts together, mapping them being mapped out very clearly, then again went down to see where those that there are interventions already taking place. So then those get knocked off a bit. So then the third bit would be, if the gender violence is too high within these places, then again, and there are interventions taking place there already, like where care is working, again those districts get off, because we don't want to mix up our work with where care is participating. So then the remaining districts, we categorize them by region. Then randomly picked one district in some of these regions, excluding the north. So then that's how we came up with one district in each. And I remember when PG was chosen, I was like, oh, can we change it? Because I remember I'd made some noise, but I said, this is what it said, because I was like, you know, sometimes when you're doing research, you know which tribes are more difficult. I'm sorry, my fellow Baganda. But when you're dealing with Baganda on data collection, it's highly monetized, you know? And you do not want to include some of those things. But we had to, because that's what the randomization had indicated. And we had to do what is there and live with it. You know what I mean? So that's, we could respect what the random selection had said, because I knew we were going to face those challenges, and we found them, but we expected and anticipated them. So that's how the districts were chosen. Then for sure the RCT is not fully representative, because most of the time with the design process of an RCT, it's usually around the small area for scale up, to see what's working within the small areas. So partly because of budgets, but we also could not cover the entire country as well. But with the RCT, since you are doing experiments, you have to choose your persons who are willing to be part of this experiment at the end of the day from the samples you've actually randomized around. How did we merge the qual and the quant in terms of triangulation here? So where we had randomly selected these homes we visited, and the parishes we visited, then the qualitative team went in the same areas that we had actually chosen, looking for the same participants that who are going to participate, who had participated in the quantitative research, such that what we have missed, they would actually ask. Probably it would have been a good idea that after us, they come in to fill in the gaps of what the quantitative team could not capture beyond what we had. Because the figures, a lot can be put in figures, but most of these discussions can be done further by some of the stories you've had. A man should not be, I can never see my father mingling posho. It would never come out from our quantitative, but came out from those communities that were selected. So with these kind of ideas, we think then there are a lot of things to work. So that's how we kind of mapped out to see that these triangulate each other in terms of the information we are having. How did we tackle the seasonality? This one I think is in terms of probably time use, how we captured it. Is that what you meant? The seasonality component of it. So basically when you go to any household, we ask you in the last 24 hours, what were you doing in terms of your time? So within the 24-hour timeline. Someone said between 8 and 9 I was doing this, 8 and 10 I was doing this. So that's how we kept on to capture how much time someone is spending on the activities we've listed. And for someone even who has asked a question on how did we capture unpaid care, based on the definition we have on activities around unpaid care, if someone actually said they were doing that activity within that time, then that's how we would actually collect that this and such a time was spent within the 24-hour clock on unpaid care activities or paid care activities based on what we have put out on and actually really validated in terms of the activities we have put out there. So that's how we did it, using a 24-hour our timeline in terms of where you are spending most of your time. Okay, so probably even towards at the end, when you're doing the actual estimations using maybe the diff in diff, we can control for some of these seasonality issues and district level heterogeneities to ensure that certain things are coming out clearly. Sorry for those who don't understand some of my boring heterogeneities and the diff in diffs, but we shall try to ensure we bring it down at the end of the end line. I submit, Chair.
Yeah, thank you very much, Doctor, for that. Methodological issues are, of course, always, you know, those who teach that know it's a philosophy of its own. But thank you so much, and none of them has foolproof, of course, at the end of it, but we try to be as rigorous as we can. Let me tackle one question from Nafuna, just briefly. Why VSLA, which is seemingly an economic issue, you know, and we are dealing with social gender norms? Many reasons, but let me just speak about two, one briefly. One is that in the power model, P tests the assumption that if you increase economic empowerment of women, you know, you solve many issues. You reduce cases of gender-based violence because some gender-based violence is driven by economic issues, or you could even shift unpaid care work because, for instance, the woman could afford maybe to pay somebody, or her value might increase, and then the man might say, now let me help, and so on. That is one assumption which we are testing. But the other is we could have used any economic arrangement. For example, income generating activity, paid employment, or whatever, anything that brings in income. But in this case, or even farmer groups, we actually wanted that or both. But research shows that VSLAs are not just economic groupings, but they also hold people together for a long time. Actually, people stay longer together even after the end of intervention. So we use it as in our programming language, we call it as a base for layering. You can introduce other things on that VSLA. So you can introduce training around gender norms, which you are doing actually, training around unpaid care work. You can bring in income generating activities, etc. So this intervention is trying to make the VSLA to work as a VSLA. So some of them were formed spontaneously, but now we're making interventions to make sure that they are actually VSLAs which can promote economic empowerment so that you can be able to test that. So that's how we used it. So the VSLA, yes, is an economic issue, but you could tweak it to be a social issue. I mean a social base for social results. I think that is what I can say in brief, but it's quite a lot that we can share on this. When you discuss gender and exhaust, it is not gender. So if you feel we have not exhausted, then we have discussed gender. So I want to end it here for that phase, and we move into the closing part of it, and then we'll end it with the lunch, unless there is a very burning comment which can be communicated in only 30 seconds. Otherwise, I want to thank you so much. Can we have an applause for all of us? For the presenters, for all of you. For me, I've not had an applause for me. And for ourselves. Thank you so much. I think we have Executive Director for Economic Policy Research Center, who is going to give us some closing remarks, Dr. Cyrus Sewanyana, ED. Very warmly welcome, ED, to give us your closing remarks, and we call it a day. Thank you so much.
Good afternoon, everyone. We are going for lunch. Good afternoon, everyone. Thank you so much. My job is a simple one. I am just to say thank you for your participation. Thank you for honoring our invitation. And thank you for being patient with us, because we thought that people would be going out as the meeting progresses. But thank you so much for keeping around. I also wish to extend our sincere appreciation to EPRC Canada and the government of Uganda for the support that they've given us towards this project. Why am I saying government of Uganda? Where I sit at EPRC, government of Uganda gives us some money. And where Makerere University sits, government of Uganda also gives them some money, okay? So we are also contributors in this project because we are supposed to provide something in there. So I thank government of Uganda for that. I also want to thank the project steering committee members who have been able to make it here. Thank you so much for sparing your time. Sheikh, the chair, and PSFU, thank you so much for being part of us. I want to thank the project teams under the leadership of Professor Grace Bantebia, and I think you saw there was something written last week on unpaid care work in New Vision and Monitor. It was part of this project, and we wanted to alert you that something is coming. So, Professor, thank you so much for your leadership. I also wish to thank the organizing team. Yes, project team has been part of it, but we really have some two people whom we cannot really miss out. Peruth, I don't know whether she's still around. She's not here. Okay. And also thanking Elon. Okay, thank you so much. And I also thank the Makerere University School of Gender, as well as our colleagues at EPRC for the work well done. I forgot to recognize another project steering committee member, Mr. Senono. Thank you for joining us. Thank you so much. I also want to thank the moderator. You know, when he speaks around the power model, I always open my outer ear and inner ear so that I can be able to hear it and understand it from you. So thank you so much. And this is one of the things that Annette from EPRC talked about. How can we scale up some of these solutions that we found in other aspects that have worked? How can we scale them up elsewhere? So we are trying that, and we are sure that we shall get there, okay? And we did not tell you why you were invited, and I want to tell you now. When you look at the power model, remember the power model? Forget all about the P, forget all about the O, forget all about the W. So you are here because of the ER. Okay? You remember the ER as explained by Dr. Madanda. You are here that you can be able to engage you at the initial stages of this project, okay? Reach out to you so that at the end of the day, the findings of this project can have a greater impact on the lives of our women, on the lives of our men and the lives of our children. Okay? So you are part of the lab. And you have been successful in, because I was listening in, and I was listening to Minister of Gender, the way the lady came out, I don't know where Hajat has gone. I was so happy that we are holding her minister at ransom. Okay? So when I listened in to the religious leaders, then I said, also we are really there. And I like the civil society, the way they came up. They need this information for their advocacy. And as a team, we are not going to take that for granted. We have to make sure that we continue engaging and reaching out to the civil society. Now, when it came to the parliament, leave alone the nyege bit of it. So when it came to parliament, then I could also hear that, look here, we can be able to get your findings and influence the regulatory frameworks around unpaid care work and so on. Okay? So what we did not hear, where our experiment has failed. Oh, from the private sector we have also heard. Where it has failed is on the cultural leaders. Not so. But next time I promise that we shall be here with the cultural leaders and we shall be able to move along with you, and we are sure that you can be able to make a difference. So that this project is here to be able to close the policy, the practice and programming gaps that we see in government as well as public sector. That's why our theme is from promises to actions. Government has promised. When you look at the NDP, government has promised heaven and earth. Are we there? And you've seen the level of infrastructure, the access to infrastructure and so on. Government has promised. Even the religious leaders have promised us that there is God, okay? And God treats all of us as equal people before him and so on. The cultural leaders have also promised. The parliament has also promised. But what we need to see at the end of this project, that we can be able to move together from the promises to actions. Okay? So we do hope that we shall be able to do it, to get there. And there are opportunities that you cannot also take for granted as a project. And under the leadership of Professor, under your leadership, they've told us, okay, that there's an ongoing policy review at the Ministry of Gender. So I think we need to see how best can we be part of that, so that you can be able to contribute on that. And the lady also told us that there are new policies that are being crafted, family policies and cultural, all those. I don't know how they speak to each other, but let's try to make ourselves relevant to that. And the other thing they've also told us, we should not really forget all about the National Development Plan, which is not only talking about mindset change, but also there is a shift from thinking through sector to programming approach, okay? Where we require that all the key players are part of this. And again, when I look at our experiment of the ER, we do have all these multi-sectoral, multidisciplinary, multi-sectoral people here present with us. And I'm also trying to be selfish. When I heard Lillian talking about the, was it Lillian? No, the lady, Annette, she's called Annette. Agnes, when she talked about the African free trade. For us as EPRC, we've picked that and we have a theme around that, and we are going to put gender around it, okay? So when you come here as EPRC, we don't only come to disseminate, but also to steal your ideas. And we make your ideas more realistic and so on. So members, thank you so much for joining us. Thank you so much for your constructive engagement. And thank you so much for your contribution towards our ER in our power model. Thank you so much.
Thank you very, very much. And I want to assume that each of us has got the lunch coupon. And it's my sincere hope that we also have the appetite. Now, there is just one small proposal, one small request, that we all come here and take a group photo, and then we go for our lunch. Thank you very much, Dr. Sewanyana, for those closing remarks. And hopefully that is a humble request. So kindly, let's move to the front, and we take one group photo, historical photo for all of us. Thank you so much. I think here. Okay. Yes, thank you so much, and our colleagues online, those who joined online, thank you so much for staying in touch up to now and for making your comments. We didn't receive any hand from you to speak, but I hope we represented you so well. Thank you again. And thank you everyone for joining. Kindly let's move to the front. We keep this in the background and we take our group photo. I've already taken the position, so kindly join me. And we have a group photo. Very welcome. Okay, I'm informed you might receive some logistical information on your mobile phone, so I hope you registered well.